Reading 94.7 FM. Highlights, challenges women face by educating and enlightening the public with the aim of changing stereotypes that affects the progress and development of Nigerian.
How do you like that?
It brings to fore the issues of rape, sexual and gender-based violence, harmful cultural and religious practices, amongst others, every Wednesday by 9:30 a.m. to 10 a.m. until the next Reading 94.7 FM, Abuja.
A very good morning to you, dear Abuja and listener. How are you doing today? It's Women Voices on Rhythm 94.7 FM. Urinary tract infection is what we will be talking about today. Remember, we were talking about personal hygiene, especially amongst women. How would you, keep that place clean? And just in case you notice some abnormalities, how do you think you will fare well? We're talking about it, and I thought, why not bring an expert? Why not bring a specialist on the show so that we are going to be able to treat this and know what we're doing instead of just, going merry-go-round. All right, we have Dr. Samuel Aliyu. Dr. Samuel Aliyu is a maternal and child health specialist. We'll be talking about all we need to know about urinary tract infection, UTI. I know some people call it toilet disease. It would tell us whether I saw the look on his face before the show when I said they call it toilet disease. Toilet disease? No way. All right. Okay. So we have Dr. Samuel Aliyu. How are you doing today?
Yeah, I'm very well. And you? How are you doing?
Very well, thank you. Okay. So we go straight to the point. You tell us all about UTI and what we need to know about urinary tract infection.
Okay, so as the name suggests, urinary tract infection is an infection of the urinary system. So it extends from the kidney to the ureter, to the bladder, and to the urethra. So it's more like a system of tubes, and organs that make up that system. So any infection, to the tract, it can actually, cause UTI.
Infection. Okay. So, what are the causes? A lot of people believe, not even a lot of people, me personally, I always believe that if I go into a toilet that is not well taken care of, I may catch something. I and 1,001 other women share that belief. So because of that, if I'm going to make use of public toilet, I'm always like, no, I don't want to make use of this toilet so that I do not get an itchy under. So could you clarify, especially when people call it toilet disease or they feel that it has been contacted or it's being contacted via the toilet?
Okay, so maybe I should just tell you how this really works. We're discussing UTI. So the kidney actually performs the function of urine production, right?
Yes.
So urine goes down through the ureter and then to the bladder and then to the urethra. The urethra is the opening that takes the urine out of the body. Okay. So but when it comes to infection, right? So it's caused by a bacteria.
Okay.
So the bacteria, comes from the outside, introduced from the anus, and it climbs up via the urethra to the urinary bladder.
Yes.
Okay. So when it gets to the urinary bladder, what happens is, bacteria, when they climb up to the urinary bladder, what they want to do is to colonize the whole system. They take over the whole system and begin to spread. So when it spreads, if it is not treated at that point, it could climb up. It climbs up through the ureter and then to the kidney. Okay. So we do not want it to get to the kidney. Okay? All right. So, but again, you are talking about
toilet
infection.
Yes.
So I hear that a lot. Okay. But again, I do not think that toilet infection or whatever you call it is caused or the main cause of UTI. And the reason is because if you use a toilet seater, there's no way germs can magically fly into your system. You can't introduce germs into your bladder using a toilet seater. It doesn't work that way. So what happens is you already have bacteria within your system, right? So I just said annulus from the annulus is easier to move these things, up towards the ureter and then to the bladder. So if you have something like Escherichia coli, which is the common organism in the GI,
Yes.
okay, in stool. So if you go to toilet and then you don't properly clean up, and then you clean probably from the back to the front, so you are likely going to introduce that organism into your urethra because you're not cleaning properly, you clean from behind forward. So and that is why we encourage women that when they use the toilet and they have needs to clean, it is better to clean from the front to the back, not from the back to the front, because when you clean from the back to the front, you are introducing organism into the urinary system.
Okay.
Yes, and you become susceptible to infection.
All right, this long debate. There's been this long debate about how properly to wash. Let's end this debate here and now. Tissue or water? For you, what do you think is the ideal way to clean properly? Tissue, water, wipes. Which one?
I think water serves best.
Okay.
Okay, because some of these wipes, they come with some chemicals. Okay, and when you use those kind of wipes, in your genital area, it can actually cause irritation. Okay, it can cause irritation. It can even introduce certain things to your system. Like the genital area is something that can mediate itself, can self-regulate itself. Okay, it's it has a self-cleansing mechanism, so that can actually clean itself. So by the time you begin to bring in or introduce other things to it, it can cause irritation and then it can cause infection.
Okay, so what kind of soap do you recommend? Because some people say don't use soap at all, the place is self-cleansing, just use only water. But for people who keep pubic hair, you're asking them not to use soap, they should just use water to wash and everything. So I'd want to know, because it's been a long debate. No, use mildly scented soap. No, there is a soap specifically for it. Or no, just use warm water. Oh, just use cold water. What do you think is the ideal way to wash for women?
I think the ideal thing is to use warm water, not hot water. Warm water, and then mild
soap. Okay, okay.
Not harsh. That place do not need something that is harsh to get there, right? So just something mild and warm water is fine.
Okay, okay, all right. Would like to know the symptoms, because for me, at times I'm always I have a very sensitive skin, very sensitive everything. So because of that, I'm always really very particular about the kind of undies I use. Some will say use cotton undies. Some will say if you're using pant liner, don't use the one with anion, So I'm always very particular. And then when I see a few changes, I just start to panic, like, no. But how do I know the symptoms between, and you know that UTI and STI are somehow interrelated, sort of. Yeah. So how do I get to know the symptom to now know that I probably need to see the doctor? I just need to buy over-the-counter gels, apply, and then be fine.
Yeah, so the symptom depends on where the UTI is occurring, right? It could be the bladder, it could be the ureter. Okay, so and symptoms could basically be about urgency, having a feeling of going to urinate, and then frequency too. Okay, and then when you go to urinate, you could have a burning sensation, kind of burning feeling, like a hot feeling when you're passing urine. That's what we call dysuria. You can have that painful urination, dysuria. So, and then sometimes you could even see somebody peeing with blood. That's hematuria. Okay, so when we see that, it only gives us indication of where the infection is. So if you see blood in the urine, it tells you that the infection is probably down there, probably at maybe the urethra, or the bladder. But sometimes someone can pee and you will not see blood. But when we run tests, with the urinary test strip, it could show that there's blood. Tells you that it's up there, probably around the kidney. Okay, so that's what happens. So with symptoms and signs, there's the urgency, there's the frequency. You have the urge to go and urinate, and then when you even get there, you just pass small amount of urine. So that's what happens. But with STI is quite different. Yes, they have similar signs, but for STI, your vagina.
No, it's okay.
So
It's
you-
educational, so I
Yes.
totally understand.
So you have a lot of discharge
Yes.
from that part. Okay.
Foul.
Yes, with foul,
Foul
smell,
smelling,
right?
yeah.
Also, UTI, you also have foul smell. Okay, you also have foul smell. But the difference is, with STI, you don't have that urgency to say you want to go and urinate. You don't have that burning sensation within your system. So, but with the STI, you have that foul smell with foul smelly vaginal discharge.
Okay. All right. Just in case you want to, you may have some questions to ask concerning this. I find this really, really very enlightening, educative, and detailed. You can send us WhatsApp message on 0817 8000 947. That is 0817 8000 and you can also give us a call on 0901 094 7777. That is 0901 094 777. There's a question I want to ask. Can one contact UTI via intimacy?
Yes, of course.
Okay.
So,
Yes. Because
when you have
yes.
multiple sexual partners, that
Okay.
puts you at risk of contracting UTI. Yeah, so you have some people who move from one partner to the other, and that's not quite good. That's not healthy. So because for every individual, we have what we call normal flora. Okay, so when you have a partner, the partner also has his own normal flora. So there's a kind of agreement between your bacteria and your partner's bacteria. So the time you move from that partner to a new partner, there's a new set of bacteria that is being introduced this time. So, it kinds of clogs your system and predisposes you to infection. So that is why we advise people to stick, to a partner, a sexual partner. So, and there's something we also say about, the honeymoon cystitis. So the woman gets married, and of course they go out for more honeymoon. You expect that a lot of things will happen during the honeymoon,
Yes.
right? So, and as that is happening, women may feel some discomfort. We encourage women to speak when they feel that kind of discomfort, to say, "Oh, let's slow things down," because it could get to a point that the bladder becomes irritated, and at that point, if a bacteria or a germ finds its way into the bladder, it could establish itself and then cause infection and begin to spread. So it is always good that when you and your partner are engaging, it is good for you to speak out when you begin to feel some discomfort.
All right. Okay. Now this takes me to it takes me to some kind of habits during intimacy.
Yeah.
Some people are not really that hygienic. I'm talking about for men who may not really practice some hygiene, sort of hygiene. Then in the course of intimacy, is there a way that it can push bacteria directly or indirectly into their partner without knowing? And yes, because a lot of people mistake it as, oh, you've gone out to cheat and then you brought in infection. But is there a way that the man may not be cheating, the woman may not be cheating, but because of some unsanitary practice between them, is there a way it can cause infection? I'd like you to treat this.
Yes, of course. So, and that is why I was talking about the multiple sexual partner thing the other time, right? So, yes, so, and again, one thing I need to point out here is the female urethra is short compared to that of the male, okay? So, the male urethra is like 20 centimeters long. That's like 7.5 or between 7.5 and 8 inches. That of the female is between 4 and 5 centimeters long. So you can see the difference. It's very short and straight. So it is very easy for bacteria to travel from the anus right to the urethra and then to the bladder. So because the urethra is very short. So once there is any, intimacy, and then maybe your partner, the male partner, is not clean, it's very easy to transfer that infection. Very easy because of the size of the female urethra.
All right, okay. So at what point should I see the doctor? Like, like I said, that a lot of us are used to, self-treating. You just go to the pharmacy, and the pharmacy will say, okay, I think this is wrong with you. Take this gel, take this insertion, take this antibiotic, and you're fine. Then you go, after you've treated it, you're fine. You go back again and everything. At what time do I think, oh, I need to see the doctor?
Yeah, so when you begin to have that feeling like of unwell, the signs I mentioned earlier, burning sensation, you go to toilet too often, and when you get to the toilet to pee, you pee maybe just small amounts, okay, and then you are having that burning sensation, that burning feeling when you begin to pee, and some pain, intense pain when you pass urine. So when you begin to see all the signs and symptoms, then you know that you need to go to your doctor. Okay, so not to the pharmacist now, because sometimes we go to some of these drug stores, and we describe our feeling to them, and then they just give you anything. They just give you antibiotics. They just mix it without proper testing. So, and that is causing problems for us today. We have a lot of resistant strains of bacteria. So the right thing to do is to go to a health facility, because we are talking about your health now. So we're aiming for the the wellness of women. So you go to the health facility, follow the normal process and procedure. So you see a doctor, and then he sends you for a test, okay? And then the test points to the diagnosis, where the problem is, and then the right treatment for your infection. So because some people feel one kind of antibiotic can take care
of everything.
It doesn't work that way. So we have several bacteria causing UTI and other infection. So there is no one specific antibiotic for. So we have different antibiotics specific for different bacteria. So I think people should know this.
Okay, so what about people who will just go to the lab, test, and then with the lab results they go to the pharmacy that's boycotting the doctor?
No, that is not right. That's not right. There's a chain of there's a system how it works in the hospital. So you need to see a physician first, who would listen to your complaints, listen to your symptoms, and then guide you properly. Because if you just go to the lab, these places are established to make money. So, and this is where governments also have to come in. Regulatory agencies have to come in to regulate the activities of patent medicine stores and also medical laboratory structures, okay, to ensure that they follow the right thing. So you cannot just go to a lab and just explain your problem, and then they take without any prescription or anything from the hospital or from the doctor to say this is what we are suspecting, like a prognosis. So usually it is wrong to do that, because it can even put you at a risk of getting yourself more infection.
Okay, so I've heard really, really very serious issues about infection left untreated. Some people said that it has damaged the womb. Some people said that it has. I've heard so many things. How worse can an infection get if it is left untreated?
Yeah. So talking about UTI now, I've tried to explain how this works. Okay, the bacteria tries to establish itself, within the bladder, encroaches the bladder, takes over the entire architecture of the bladder, and if it's not treated at that point, it begins to go up. That's an ascending infection. So it goes up, climbs through the ureter, and then to the kidney. So when it gets to the kidney, it settles there, and it can cause what we call renal failure. Okay, so and people die from this. Yeah, and then if you're lucky, you can get dialysis. Okay, so your kidney completely shuts down. So this is not what we want. This is not the path we want to go through. So once you begin to feel that discomfort in terms of urgency, burning sensation, and all that, just go to the doctor. Then he will be able to guide you properly. If you need to have a test, he can tell you to have a test or a scan and all that, just so that at the end of the day you become well. But if you leave it untreated, it can lead to renal failure, which is really, really bad.
That is serious. Okay, so what can now happen when infection now eventually gets to the kidney, which can be fatal? What should the person now do when it gets to that point?
Well, it now depends. It's not about the person now. It now depends on the management team to say, okay, this is the plan. This is what we're likely going to do. Probably usually it's dialysis. Okay, do dialysis. But how expensive dialysis is to have that done. So it's not a state you want anybody to be in. Okay?
Yes.
And that is why we advise people that once there's any suspicion, you suspect anything, particularly women, when you suspect anything, do not hesitate. Report to the nearest hospital, not to a drugstore, a dispensary. Go to a hospital. That is where you can get help. I think that is the right thing to do.
Okay, so it's safe to actually say that delay in treatment of UTI can cause kidney failure. Is it safe to say so?
Yes. Yes.
Wow, that is serious. Okay.
So that's why I advise people to act promptly. Act promptly.
Okay, there's another curious, something I'm curious about. We are all different. Our immune system and everything is different. What is the speed of time, if left untreated, can travel all the way to the kidney?
Good.
What speed of? Yeah.
Okay, so you see, it also depends on individuals. For a diabetic patient now, okay, a diabetic patient who has UTI is terrible because usually their immune system isn't strong, and you look at the urinary bladder, it's designed in a way to ward off bacterial infection. Okay, but when the defense systems are not strong enough, for instance, for people who are diabetic, the bacteria, thrives and flourishes there because the defense mechanism is broken. Okay, and for those people, they could get that infection fast even to the kidney, and that's bad. So you have multiple organ failure, not just the kidney, affecting other systems.
That's serious. That's serious. Okay, so overall, how do we prevent that's UTI? What are the safe? Because what most people do now is guess. Like I said earlier, I would be saying, okay, I don't want to use so toilet because I do not want to catch toilet disease in quotes. I don't want to use so kind of pants. I don't want to use so kind of product and all of that because I do not want to expose myself. So what are those measures you think one can use to prevent urinary tract infection?
Okay, as I said, it's always good to wipe properly. So you wipe from the front to the back, not the other way around, right? Then also, you're on this, right?
Yes.
So it's always good to wear something that is free, not something tight.
Okay.
Because when you wear something tight, the place can get wet, and then it can attract, that environment can attract, bacteria. So also for women, depends on the number of times that you shower in a day. But of course, I know women could have shower like 2 or 3 times.
Yeah.
So at every point in time that you shower, also try to, change on this. I think that will help.
Yes, we've had this on this argument too, on how to keep your undies clean, how to sun dry because a lot of women, I know people who won't want to sun dry their undies because of certain things. It's not because they are shy, but because we have a lot of belief in this society. You don't want someone to pack your undies and start using Benz the next day. You understand? So people really do not want to. So how do you find you have to change your undies every day, normally, regularly, and you're taking the undies, you're washing it? Do I iron after it dries? Do I put antiseptic this thing while washing it? Do I need to really treat it specially? Do I need to? Yes, then there are some people who believe that you shouldn't wear undies to sleep also. Are there any particular myth or speciality about undies? Yes, some even say it has to be free, it shouldn't be tied, you shouldn't put on G-strings, because if you put on G-strings, it enters into where it's not supposed to. Would want to know that one too.
The whole thing is, safe practice, ensuring that we are not introducing any extraneous germ or substance into the body. Okay, because everything we are saying is about how the body takes in certain things and uses that to cause problem for us. So all this is we are saying, it's not like the bacteria is coming from outside, it's within the body, it's within the system. Okay, so when you use G-strings, or what you call
Yes,
it,
G-string, yes,
and all
catapult.
those just ensure that it's not something that is so tight fitting, okay, that can encourage maybe warmth and all that, because bacteria thrives in that kind of warmth, heat environment. Okay, and then washing too. I think just washing your undies with soap is
Normal.
fine. Yes.
Sun dry or not?
You can sun dry it. Are you going to leave it wet?
No, probably under shade or some people dry it in the toilet. They don't bring it out.
Okay, but I don't see anything wrong with it.
Okay,
anyway. Yeah,
really?
So you can actually, it's just to maintain a healthy life.
Okay.
Yes.
It's not that hard.
It's not hard, my sister.
Okay, thank you so very much. Would like you to give us your parting shot. A parting shot.
Yeah, so we all want to look good. We all want to look, comfortable and good when we sit with people, sit around with people. But you see, it all boils down to personal hygiene, okay, how we take care of ourselves. So I've heard somebody tell me that there was a friend of her who sat close to her and she could perceive something.
Yeah.
And that's not right. So it has to do with how we take care of our health as a people. So I think it's important for us to pay close attention, particularly female gender. Pay close attention to your health so that we can prevent all these infections.
All right.
Thank you.
Thank you so much, Dr. Samuel Aliyu. Dr. Samuel Aliyu is a maternal and child health specialist. Thank you so much for coming on the show. We hope to have you some other time to talk about all these things. We hope so.
That's okay.
All right, okay. All right, okay, that is it for today. But before we go, we'll be taking comments from Wale Oguntokun all the way from Lagos. It says, your guest is right on point there for people to clean with water rather than tissue or wipes. Aside from the points he raised, water will completely clean you up as against tissue paper or wipes. Still leaves some residue behind. Also, Oshan Soya Esther Olamide is also saying, good one, Doc. It is really educative and informative. Thank you so much. Also, Shaulu Khadijat, thank you for being on the show to help with our social media. Afolabi Messi and Adewumi Bridget, thank you all. Thank you, Marvelous on Radio, for producing me. I remain at Atinuke Nukay Women Voices. Join us same time next Wednesday, 9:30 a.m. to have a lovely day ahead.